Hey guys, today I have with us Elizabeth Allen. She is the Health and Enrollment Specialist at my Pain Eraser program. She's the voice and the face that most people talk to when they first book a call to see if they are going to qualify to work with us in our program. And I thought I would bring her on with us today because you might look at this beautiful woman and think, I bet she has never had a drop of pain in her life. Well, how wrong would they be, right, Elizabeth?
Right.
Yes. So Elizabeth and I found each other through our sons, and then we found out that we wanted to work together, unfortunately because of her pain. And I'm going to dive right into that in just a minute, but before we get into it, make sure that you hit that subscribe button and the notification bell so that you are notified every week when we release fresh, new, thought-provoking content. Hi, I'm Dr. Brandy Lipscomb, and I am a naturopathic doctor and the founder of the My Pain Eraser program and the Painless Prosperity program for health professionals. So, Elizabeth was a friend of mine, and she came to me because she was having pelvic pain after giving birth to your third baby. And she was studying epidemiology at the time. But Elizabeth, tell us a little bit about tell us a little bit about that story. Yeah.
Sure. So I started experiencing pain in my pelvic region when I was in my first trimester. It was pretty early on. I had my 3 babies pretty close in age, and it took a toll on my body. I kind of dealt with the pain throughout my entire pregnancy. All of the doctors kept saying, oh, it'll subside after the baby's born, it'll go away. Then my daughter was born, and lo and behold, the pain didn't go away. It was really unfortunate for me. So I went back to the doctor, and they said, oh, sometimes it can take months. Sometimes it'll take 3 months after the baby's born for everything to kind of come back together. So I dealt with it, and I lived with it for 3 months, and still didn't go away. Went back to the doctor, and that's when they said, well, maybe you need gabapentin, which I was a breastfeeding mother, so it wasn't an option for me. It wasn't something that I was willing to put in my body and potentially pass on to my baby. So then they said, well, wait it out a little more, it'll go away. Sometimes it can take more than 3 months, it'll go away. And I waited it out even more, and it never went away. It was just this really severe pain at the base of my spine, in my sacroiliac joints. It was interfering with my life. I mean, I couldn't play with my kids on the floor. I couldn't sit in a chair for 10 minutes and have a meal with my family because the pain was so excruciating.
Oh.
And they wanted to give me pain medicines, which isn't an option. It's a Band-Aid. It doesn't fix the pain. And then they said, well, we can inject your sacroiliac joints with steroids. Finally, they did some x-rays, and they said that I was developing degenerative arthritis in my lumbar spine and in my sacroiliac joints at the base of my spine.
At the age of?
At the age of 29.
Oh my gosh, right? Like, these are not the types of things that you think happen to beautiful 29-year-olds.
Yeah, it was a really unfortunate diagnosis. So then the recommendation after they made this diagnosis of degenerative arthritis was that they wanted to do surgery. They wanted to put pins through my hips and into my sacrum to stabilize the pelvis. And which didn't seem like a great option, and seemed even less like a great option after I realized the recovery time. I had 3 young kids at home. I mean, my daughter was all of 8 months old at the time. She was still an infant. And I knew that that wasn't an option either.
And so when I offered you a treatment with the first TX in your living room, what was your initial reaction?
You know, I'll never forget that day because I was in so much pain that day that I was literally laying across my island in my kitchen.
Right.
I'll be honest, I was quite skeptical at first. But
fair enough, most people are.
But I was in such desperate need of relief. I was so desperate to try anything that I agreed, and I laid down, and I'll be honest, you really challenged my understanding of what the medical community can do and how they regard pain.
Right. And Elizabeth, tell me about the pain relief that you got from that first treatment. How long did that last?
The treatment duration itself lasted for about 20 minutes, and I stood up after 18 months of chronic pain. I stood up and had no pain for the better part of 12 hours.
Right, which is pretty awesome.
Yeah, I mean...
Yeah, 12 hours of pain relief just in one treatment. And then we ended up getting back together again.
I think it was 2 days later, we did our second treatment together. And after the second treatment, I got about 24, maybe a little over 24 hours worth of relief from that second treatment, which was a blessing at that point. I mean, it truly was amazing.
And did you sleep better?
Oh, I slept for the first time in months.
And so it wasn't long after that I said, here, keep this device and try it for a little while at home. Give yourself a couple of treatments. Tell me about that. Were you nervous about using it at first?
I had your guidance with it, and the device, once you sort of have the basics, the foundation of how to use it, then you realize that it's really quite intuitive.
Once you learn the principles, they can then apply these principles to every other part of the body. Speaking of, let's just start with you alone. We're not even going to get into your whole family yet, but what other body parts have you found benefit from the Pain Eraser program?
I mean, what body part haven't I found benefits for? Truly, I mean, anytime that I have headaches, I have a history of migraines, so I use the bye-bye headache technique whenever I have migraines. If I'm feeling stressed out or anxious, I know that I can do the 4-minute reset on the nerves on my face. Occasionally I get low back pain, knee pain. I can address those with the device as well.
And how about your shoulder?
Oh, my shoulder, yes. So I have a rotator cuff tear in my shoulder, which the recommendations beyond physical therapy are injections or surgery, which again, just like my back, I wasn't willing to subject myself to. So I started doing some pretty intense treatment on my rotator cuff with a device, putting the electrode lead wires and pads on, doing some active range of motion with that. And I was able to, it probably took me about 3 weeks, but I was able to get full range of motion back, and I am no longer in pain in that shoulder.
Amazing. That's so impressive. And can you raise your arm? Yes. Ta-da! Yay! Amazing. So you've found that you can use this for so many different things. You've been able to avoid at least 2 different surgeries. It's impressive. But even more impressive are some of the what we'd consider off-label benefits that you've noticed in your family.
Absolutely.
Would you care to share a little bit about your son Atlas?
Sure. I'll tell Atlas's story. You'll have to forgive me because I do get a little emotional when I tell Atlas's story.
I love him.
Atlas was born premature at 36 weeks, so not the most premature baby ever, but he did have a few complications that went along with his premature birth. Mm-hmm. He was always the baby that just never wanted to be held. It was like, feed me, put me down, don't touch me. And over time, we started noticing that he had some delays. He was eventually diagnosed with a speech delay and with sensory processing disorder, which kind of made everything make sense. We were like, oh, that makes a lot of sense. I started taking him to occupational therapy, and his therapist described the sensory processing disorder to me as his brain wasn't communicating with his tissues the way that it should. So a sensory input to you or I that would tickle or feel relaxing to him burned or was painful. Mm-hmm. So one of the most common things with Atlas early on was that he hated his feet touched. Right. And when I started doing some research on these retained reflexes, this sensory processing disorder, and after the explanation from the occupational therapist, I thought, well, isn't that kind of what this technology does? Doesn't it sort of make your brain communicate with your tissues in a more effective manner? So I decided that I was going to start playing around with the device with Atlas. I thought, what's the harm, So we started very slowly. In the beginning, he was probably about 3 years old when I started using the device on him. We started on the bottoms of his feet, just to what he could tolerate. You know, I didn't want to overwhelm him. And very quickly, we noticed that he wasn't so sensitive on his feet anymore. And then I slowly worked my way up his body. And he eventually got to the point, actually pretty quickly got to the point, right, that he would ask me for the device. He would go get the device and bring it to me and hold his arm out and say, I need a treatment. Mommy, give me a treatment. And
amazing.
He enjoyed the treatment so much that he actually began using the device on himself with my supervision, of course. We really rapidly saw a difference in his behavior, in his temperament, in his mood. He wasn't quite so tantrumy. He was responding to stimuli in a more appropriate manner. And then one day I took him into occupational therapy, and his therapist came out of the room and took me into an observation room and said, what did you do? What did you do to this kid?
Right.
And I said, what do you mean? What are you talking about?
True story.
And she said, what medication did you put him on? You
Right.
took him and had him medicated. He is a completely different kid. And I said, no, really, I didn't. This is what I've done.
He used to pull at his hair, didn't he? I remember.
Yeah. He hated his hair touched. Shampooing his hair or cutting his hair was a complete battle. And I would brush his hair and run the device on the scalp of his head, and it really rapidly turned things around there as well.
That's pretty amazing. I also use the brush attachment on my dog. I've used it for her hips when she gets a little sore. You know, you can spray them down. I like to use like a little salt water in a spray, and I'll spray her down and I'll treat her hips. And she's 14 and she still sails into the back of my car. And I also find that it's really beneficial around thunderstorms. You know, she gets really anxious, and so the one of the principles of the technology is that we're mimicking a more parasympathetic shaped waveform. And so when we are sending these waveforms into the body, the brain thinks that it's its own endogenous parasympathetic shaped waveform. And so the first reaction, dogs and humans alike, is amazing story, and thank you so much for sharing that with me and with all of our viewers here on YouTube. So what about other family members? I remember your mother in particular, and I would love for you to tell us a little bit about your mother's story.
Absolutely. So my mom has a heart condition, and she also has bone-on-bone knees, which makes things really complicated. Her knees, she had bone spurs, they were bone-on-bone, they were incredibly painful. She was really rapidly losing range of motion and mobility in those joints. And because of her heart condition, it prevented her from having any sort of intervention. They kind of looked at her and said, well, sorry, live with it, you know?
Yeah.
And after my experience with the device, after my son's experience with the device, I got my mom her very own device. I sent it off to her. She lives in a different state, so it's not like I was there to oversee anything, you know.
Right.
She called me when the device arrived, and then about 2 weeks had passed, and
all we did was put her in the program, right?
Yeah.
So she was getting the training videos and the entire library of how to use the device. Neither one of us was really talking to your mom. We sort of gave her the device, gave her the videos, and said, here you go.
Yeah, about 2 weeks had passed, and I hadn't heard anything from her. And I talked to her almost every night, and she had not said a word about this device. So I thought, oh Lord, this is a paperweight in her closet. Like, she's not doing this. And then one day she called me on video chat, and she kind of throws the phone at my dad to hold the phone, and he turns the camera on her, and she's in the kitchen just dancing and marching and jumping up and down. And I thought, Mom, what is happening right now? Like, I was thoroughly confused, and I'm looking at her going, did you win the lottery? Like, what's happening? And she said, I'm bending my knees. And then she just started crying.
Oh.
My goodness, she is bending her knees. She went from being in such severe pain that she could hardly walk to literally dancing in her kitchen with the device.
Oh.
Down, she immediately started crying and was like, this is what I've been waiting for.
Go mom is all I have to say about that story, right? Go mom. So tell me a little bit about is there anything else that you'd like to say to our viewers?
If I had to say one thing to the viewers, I would go with, if you're in chronic pain, don't wait. You know, it's natural to be skeptical. We're humans. It's how we protect ourselves. But this technology truly is game changing. I've seen it work for myself, for my whole family. I use it on everyone in my family. And it really could be the thing that you've been waiting for. So don't allow fear to stop you from moving forward and finding the solution that you've wanted all this time. Getting back in the game, getting back to doing the things that you love the most in life.
So do you have multiple joints or body parts that are in pain, or you and your family members together have a litany of painful complaints? That's when this type of technology can come in and be the absolute game changer for your health and your families. So if you're interested in learning more, click on See More and it'll drop the description down, and in the description you'll see the link for the My Pain Eraser and Rapid Recovery Program webinar. Register to watch the webinar, take a look at the entire program, see what all it entails, and if it speaks to you and you feel like it might be a good fit for you and your family, you get to book a call with our lovely Elizabeth, our health and enrollment coach. So if you've enjoyed this and you'd like to learn more about the technology, you can click on this video next to learn about how dynamic neuromodulation outperforms traditional TENS. And if you're interested in learning a little bit about other modalities that I love to use to help people get longer lasting pain relief, you can click on this video after that. As always, we thank you so much for watching. We wish you optimal health and happiness, and we will see you next time.